Christina Papp has been crossing the border regularly into BC as an essential worker. For most of the pandemic, there have been no issues.
I live in Washington State and work at Oliver Hospital on acute care.
But then in January, a border guard asked her a question she said she had never gotten before. Will you be caring for people 65 years and older?
I said, yes, I definitely do, because we look after people from 20 up to 100 years old.
Well, that answer changed everything. She could no longer bypass the 14-day quarantine rule. Essential workers must in fact quarantine if they care for people over 65.
I need a special exemption letter which would state that I don't need to quarantine if I cross the border.
It's a small rural hospital that is short staffed for nurses right now because, at least partly because of COVID. Some nurses have contracted COVID. Some are working to vaccinate people. Some are working to test people.
Papp has already gotten her first COVID vaccine, and Canning says she's careful about PPE use, and the hospital won't assign her to work with COVID patients.
They've done their due diligence. This is, I think, a good case where an exemption should be granted.
The Public Health Agency of Canada wouldn't comment on Papp's case, but says it is looking into the matter. A statement from the agency says exemptions can be granted, but they are rare. The bar for a person or class of persons seeking to qualify for this exemption is very high. Papp is losing hope, unable to understand why for almost a year she was able to cross into BC from Washington without issue.
Discretion is very significant in terms of this issue for CBSA officers. They're given a great deal of discretion to make interpretations.
Immigration lawyer Henry Chang says disconnects between agencies, changing rules, and the way officers implement rules can lead to mistakes.
They just say, oh, you're a nurse, you're crossing the border weekly, go ahead. And that's probably what's been happening.
Papp just wants to get back to work.
Just imagine if you were in the hospital and then there's only one nurse or maximum two nurses. Are you going to receive the same amount of attention or not receive the proper care?
She says the time required to get her exemption borders on ridiculous. Liam Britton, CBC News, Vancouver.